Hi, I'm Dr. Walter Creedy, and I'm the co-chair for Environmental Health Symposium in 2019. Our topic is environmental disruption, which is far more than just hormones. One of our speakers who's been with us in the past is Dr. Joe Pizzorno, who I had the privilege of co-authoring the first ever textbook on clinical environmental medicine. So there's actually a textbook for us now. And it's been just a privilege to know Joe over the years and to work with him. And Joe, you came up with a standard public health formula that assessed risk for certain diseases that you've been applying to the voluminous data that's available on the primary pollutants that we're all exposed to.
Yes. So, like you as an naturopathic doctor, I've been very aware of the role of environmental toxins in promoting disease. But I hadn't really been adequately aware of it. And by that, I mean, I didn't realize how big an impact it was having on everyday health and disease risk. So a few years ago, I was looking at the research, and I was particularly looking at the research on diabetes, because as you know, it's increased dramatically, like factor of 20 since I was in medical school half a century ago. I started looking at the research. I was noticing a very strong correlation between a person's body load of several different environmental toxins and their risk of diabetes. So I asked myself the question, well, if a toxin is known to increase the risk of diabetes, is there a formula that we can use to help determine what % of diabetes is due to that particular toxin? So it turns out there's a public health formula for doing this. It was developed, or at least applied initially, in trying to determine what % of lung cancer is due to cigarette smoking. And so there's a formula. We have to look at the incidence of the disease in the exposed population, look at the incidence of the disease in the unexposed population, and determine what portion of the population is exposed. And from that, you then calculate what % of the disease is due to that particular toxin. So anyway, when I did that with diabetes, I was stunned, but not, actually, I was stunned but not surprised. That makes any sense. Because I look at the research, when I say I hired two very bright bastard grads to help me out, it looks to me like 90% of the diabetes epidemic is due to environmental toxins. So once I made that association and made those calculations, I then started looking at a lot more diseases.
You just said 90%, 90%.
90%.
90%.
That's what it looks like to me. Okay. Now, obviously, it's only going to be meaningful if we take the next step, and that is we start taking toxins out of people's bodies and see if the blood sugar control improves. And actually, I'm working on that project right now.
Well, yeah, and I get to help you with that project as well.
Right.
And you came up with 4 major common pollutants that are found in everybody that accounted for 70%, 70 of the total risk.
But that's what it looks like. Looks like 4 toxins are accounting for most of the problem.
Now, you're going to be speaking at EHS 2019, and so you're working on doing this formula for more of the endocrine issues. Is that correct?
Correct. So I'll be looking at as many endocrine as I can. And the obvious ones, just look at my list here, obviously diabetes. Then we've got fertility. And God, I mean, actually, maybe I should ask you, do you want me to cover fertility in my lecture in March?
Well, we're talking about fertility.
Okay, well, the data on
things, but I want people to know we're not just talking about hormone replacement here.
Yes, right. So fertility, I mean, that's because much of problems with fetal viability is due to hormone disruptions. But the data on female infertility, data on male infertility, IVF failure, and fetal viability is really scary. It's like Mother Nature saying, boy, you guys are really screwed up. I'm not sure I want you to continue reproducing.
Yeah, not in this body. Body's too polluted, can't do it.
Okay. And I'm also looking at, of course, the thyroid. Both hypo and hyperthyroid are significant functions. Obesity, another one with very, very strong correlations. I've been looking at, obviously, pre-diabetes. I've been looking at polycystic ovarian disease. Unfortunately, the data is not clear. Obviously, since PCOS is primarily due to insulin insensitivity, the same things that cause diabetes ought to be causing PCOS, but the data isn't as clear at this point.
So let's just recap here.
Okay.
Diabetes, obesity, female infertility, male infertility, reproductive disorders, PCOS, thyroid problems. Now, it seems like that's the majority of what the average clinician sees in their practice.
Right. Well, for example, we look at male infertility. Well, it turns out testosterone is a big issue, and so many of these environmental toxins either decrease production of testosterone, or more commonly, they block the testosterone receptor sites. So the testosterone may look fine in the blood, but the cells aren't responding because they're blocked with environmental toxins.
Can't get anywhere. And we're going to have a whole lecture on environmental castration at the 2019 conference. So there's a lot to look forward to for the 2019 Environmental Health Symposium. It's a time to show up. Dr. Pizzorno, thank you so much for your time.
Thanks for the great honor of collaborating with you on our wonderful textbook, Clinical Environmental Medicine.
Look forward to doing more with you, Joe.
Sounds good.
Okay, bye.